My name is Kim Masone, and my speech is Here But Not Here. 5.4 million people, 5.4 million Americans, 5.4 million family members are living with Alzheimer's. Very few people realize how many are affected with this disease, and even less are aware of the effects. About 1 in 9 people over the age of 65 will be diagnosed with this disease. Alzheimer's is listed as the 6th leading cause of death in America, and the mortality rate has increased about 71% in recent years. The numbers will only continue to grow as the baby boomer generation reaches the ages at highest risk for this disease, which is 65 and older. As a former STNA who worked on the Alzheimer's dementia unit, I've seen firsthand the toll that it has on everyone involved. In my speech, I will describe what the disease is and how it affects the brain. I will also describe when the onset generally occurs and what it means to have remissions and exacerbations of this disease. Second, I will describe the effects of Alzheimer's and what it has on the person's personality and the people around them. I will also explain how the disease is managed and if there is a cure. To begin to understand what is happening to the person, you must first understand what is happening inside of them. The definition of Alzheimer's that's found on Google is said to be the progressive mental deterioration that can occur in middle or old age due to generalized degeneration of the brain. It is the most common cause of premature senility. The disease was discovered in 1906 by Alois Alzheimer's. He noticed abnormal clumps in a woman's brain who died of a mysterious illness. These clumps are now known today as amyloid plaques, which are essentially just tangled bundles of fibers in the brain. These plaques can cause loss of connection between nerve cells in the brain. This inhibits the transfer of messages between the brain and the body. These plaques disrupt the metabolic process necessary to keep neurons functioning properly. The part of the brain that is responsible for forming memories is known as the hippocampus. This is where the disease first takes place. As the disease progresses and more neurons become affected, it spreads to other parts of the brain. This will eventually become fatal to the person. The damage may start at least a decade before the symptoms of memory loss even occur. Onset usually occurs at the ages of 65 or older. However, early onset AD has been known to occur as early as 40s. The youngest person to ever be diagnosed with Alzheimer's was 27 years old. The effects of this disease go through what's called as remissions and exacerbations. A remission is when the symptoms of the disease become significantly less. This is also called the lucid state. A person going through a remission could remember everything that they once forgot and have their entire personality back. But an exacerbation is the exact opposite of that. It's when the disease takes a turn for the worse and sometimes people don't come back from it. It just keeps getting worse. As the plaques spread throughout the brain, it reaches areas that control emotion, personality, and speech. This is when the person is no longer themselves. The person is only expected to live 8 to 10 years after diagnosis. However, some have been known to live for 20 years. Alzheimer's can be separated into 7 stages. These stages range from not detectable to very severe decline. These stages are known as the following. Stage 1, no impairment. In this stage, the disease is not detectable at all. In stage 2, there's very mild decline. The person will have mild memory loss that may be noticeable to the person or ones that are very close to them. However, they will still do well on memory tests, so it may go undetected by doctors. In stage 3, there's mild decline. A person will have trouble planning and organizing and finding the right word and sometimes remembering names. This is where the disease is usually detected. In stage 4, there's moderate decline. They will begin to have difficulty with simple math and develop poor short-term memory and forget things about their past. The disease is very noticeable at this point. In stage 5, there's moderately severe decline. In this stage, the person will become very noticeably confused and they will lack the ability to give simple details about themselves that have been relevant their entire life, such as their phone number. A person is Still typically able to recognize his or her family members' faces, however. In stage 6, there's severe decline. When a person reaches this stage, they begin wandering off because they are completely unaware of their surroundings and have no memory of their personal history and are no longer able to recognize familiar faces. In this stage, they will need a supervisor 24/7, known as a caregiver. In stage 7, there's very severe decline, and this is where the person is nearing death. The person will lose their ability to communicate properly, and they will have no idea of their condition. They will need total care and can eventually lose their ability to swallow. In the early stages of the disease, the person will experience extreme mood swings for no reason. They will show an increased signs of depression, irritability, and anxiety. The aggression and paranoia will only get worse as the disease progresses. In the beginning, it is easy to just brush off the episodes as nothing because they come back to and they realize that they're having them. As the disease progresses, there are more episodes and they are themselves less and less of the time. This can be hard on the loved ones who want to spend more time with the person, but they don't recognize them and get agitated by a stranger being in their room. While I was working in a nursing home, the patients with dementia kicked their family members, their daughters, their sisters, their spouses out of their room because they didn't recognize them, and they become violent in this situation just because of the disease. They can't control their anger, and it's very hard on everyone around them. Alzheimer's disease is a disease that healthcare professionals are continuously learning about. There are still many things that they don't know about it. All the medications that are used to treat the disease have absolutely no effect on the disease. They only slow the side effects and make it easier on them. Classifications of the drug are known as cholinesterase inhibitors and neurotransmitter glutamate regulators. Cholinesterase inhibitors work by slowing the breakdown of acetylcholine. This increases the amount of neurotransmitters in the brain by increasing brain activity and creating more transmission. Neurotransmitter glutamate regulators do exactly what their name says. They regulate glutamate activity. Alzheimer's creates the overproduction of glutamate, which leads to overstimulation of neurons. The overstimulation causes the neurons to die. As of today, there is no cure for the disease. There are only drug trials that are trying to find a cure. A university in Denmark has discovered a breakthrough regarding the relationship between Alzheimer's and type 2 diabetes. With this trial, they could potentially have a cure for Alzheimer's within the next 5 years. Now that you have been informed of what the disease is and all the relating factors, you will be able to better understand Alzheimer's if you encounter somebody who has the disease or if you decide to go into the medical field. For an overview, Alzheimer's is essentially the tangling of neurons in the brain, starting at the hippocampus and eventually spreading into other parts of the brain. This allows the disease to affect more than just memories like personality and behavior. The disease will go through periods where it lessens and worsens, known as exacerbations and remissions, all while it's still developing through the 7 stages. With each stage, the person will become less of themselves and more of a stranger to themselves and their family members. While there are treatments available, there is still no cure. Only drug trials available for those that meet the qualifications of the trials. We all have loved ones that will grow old one day, as well as ourselves. The reality of the disease needs to be understood as well as the disease itself. The more people aware of it and willing to make a difference, the better chance of finding a cure. 5.4 million people are diagnosed with the disease and without a cure. Some have no idea of the disease or how it affects those around us. Do you want to grow old in a world like that? Thank you. Is that the end?